Hey everyone. How you guys are doing? It's been a while since I had did an episode and I missed you guys so much. But before we get into today's topic, I have to hit my intro. I just have to. But also before I get ready to hit my theme music. Um, Today's topic is about dermatofibroma, and I'm going to get into like specifics as to why I chose that to be today's episode. So let's go ahead and hit that song. She's got This is Kiki's talk. She's on the rise. She's got the tea from day till night, discussing music, news, and so much more. You gotta listen to what she's got in store. It's Kiki's talk. Hey everyone, this is your host Kiki, and I missed you guys like I was just got done saying. I truly miss y'all. Um, Today's topic is dermatofibroma, which is really what it is a skin growth or referred as a benign tumor. All right, and the reason why I chose this this topic, or the reason why I chose to even speak about this, is because it's personal for me, because I am going through it, and I'm currently still is going through it. All right, so I'm gonna go ahead and give you my history here. So about 2 3 years ago, I saw a bump on my lower left arm, and when I saw it, when I originally saw it, it looked like like an insect bite. And that's what I thought it was. I thought I might have been bitten by a mosquito. And so I went ahead and went. Well, I didn't go to the doctor right away. So I self treated it is what I did. So I put cortisone cream. I put Neosportin on it. I put lotion on it, Vaseline on it. I put different variety of things that I thought would take care of this bump, but but the bump never did go anywhere. But what I did started noticing within time is that the bump was very tender to when I touch it. It was tender in that whole area, and it was also painful. So within probably 3 to 4 months within me having the bump on my arm, I went ahead and went to the doctor, showed it to my primary care doctor, and she did say that she was concerned on how that looked, because she said she didn't even know what it is either. Because I asked her, did I told her that I didn't know, I don't have a clue what this is. It looks like a mole slash bump. And she asked me like when it very first got on, when I first noticed it, did it always look like that? And I told her no, not really. And I explained to her like how I'm explaining it to you guys now, how it originally just looked like a regular old bump, like an insect bite. But within time, again, it started forming almost like a mole slash aka bump. And so anyway, she said that she would just go ahead and refer me to a dermatologist. And so she did her job. She put the referral in, but I never heard anything from the first dermatologist that she referred me to. And so I so basically I'm gonna fast forward, okay, because of the fact that it really did take about a good because when I showed it to her, I showed it to her within, like I said, 3 to 4 months after I've had it. Then I went ahead and showed it to her. And so after I showed it to her, she referred me to a dermatologist. Never heard anything from the dermatologist, and so within time, I was still seeing her for other issues and other things and everything like that.
But this year, earlier, like towards the earlier of this year, I either she brought it up or maybe I brought it up. I forgot who brought it up, because there was times during my doctor visits where she'll bring up my arm and ask me if I heard anything from the first dermatologist, and I would tell her no, I have not. And anyway, this time, within this year, she said, "You know what? I'm just gonna go ahead and place another referral, but this time to a different dermatologist, entirely different dermatologist. Since you never heard back from the first one, I'm gonna make sure that I write down that I make note that to find you a different dermatologist, so that way we can get this arm seen about." So I told her that was totally fine. So once she placed the referral and everything, I did get a phone call after the 2 3 weeks after I seen her and after she had placed that referral. I did get a phone call from from the current dermatologist that I'm currently seeing now. So anyway, they called me. They scheduled my appointment. They did let me know there's a waiting list because they have a lot of patients. And so really I didn't get to see them until 3 months after the fact, because they scheduled the appointment, but I had to wait 3 months to actually get seen. So I didn't get seen until August of this year. So I got seen in August. I pretty much told the dermatologist what I'm dealing with here. I let her know that I have a bump that is very painful, and I don't know what it is. It almost looked like a mole, and it almost looked like a bump at the same time. Don't know what it is, but I let her know that's not the only bump that is actually on my lower left arm. I have others, and she was like, "Okay, let me see them." I showed her the ones on my legs, because I have three on my left leg. I have one on my upper right arm, and I have one on my back, the middle upper back, and then of course I have the one that was previously removed it on my left lower arm. So anyway, she looked at all of them. She said that the one that she wants to remove and do a biopsy on would be the one on my left lower arm, because that's the one that looked irritated to her. That's the one that she can clearly see there's scar tissue there, and she wants to remove it. And so she said she want to do a biopsy. She said she's going to be totally honest with me. She's not concerned that it's cancer at all, but she believes in being for sure and not just guessing, but she wants to be for sure that by doing a biopsy regardless, even though she's confident that it's not cancer, and so skin cancer. And so I told her okay. And so she said, yeah, so I'm gonna go ahead and we're gonna only do the biopsy on that arm only. The others don't even worry about it. And I told her okay. And so after I left, she said that we'll go ahead and schedule the biopsy 3 weeks out. So that's exactly what happened. I ran up getting a biopsy scheduled within 3 weeks from the appointment that I had just this August. So my biopsy was done last Wednesday. All right. And so before the biopsy, the appointment when she had told me she was going to do the biopsy, she asked me if I had concerns about what she was going to do, for the biopsy. And I told her, yeah, my only concern is it going to be painful? She said, oh no, it's not going to be painful at all. She says it's just like being nicked or whatever, or get a cut or something like that. That's all. And she said, plus we're going to numb you. We're going to numb you, so you're not going to feel anything. And I told her, okay. And I said, well, is there any instructions, like aftercare instructions afterwards? And she was like, well, only instructions we have for you is just don't get in no lakes, don't get in swimming pools, and put Neosporin or Vaseline on that area after we do the biopsy. And that's the only instructions we have for you. And I said, okay. And so, anyway, she scheduled for 3 weeks out. Now, let's talk about what happened on last Wednesday. So I went in last Wednesday. She told me that it was going to take about 10 to 15 minutes. I felt like it took really less than that, to be really, really honest. It took less than that. But she said it was going to be like 10 to 15, it'll take 10 to 15 minutes. And so the nurse that was in the room, she injected me with the numbing, um, I guess the numbing medicine that they, put to numb the area. She injected me, I want to say in 3 places. And she said the doctor will be in. We're gonna allow time for the medicine to work, and the doctor will be in soon. And I said, okay. So honestly, I felt like the doctor came in like within seconds of her saying that, because the doctor came in, the doctor said, "Are you ready to get this over with?" And I'm like, yeah, yeah, hesitantly though, but I said, yeah. And so she was like, okay. She was like, let's get this started. She washed her hands. She put her gloves on. She grabbed the little instrument, or the table that they placed their instruments on. They put the towel over it. They opened up the instruments and lay them there, placed them there. And she was like, before we get started, do you have any questions? And then of course I had the same questions that I had previously. Before, I just asked her, is it going to be painful? She was like, nope, it's not going to be, it shouldn't be painful, but if you feel anything, please let me know. And I told her, okay. So she's like, if you feel anything, let me know. But she was like, you shouldn't feel anything. Afterwards, it should, feel like you just got like a cut or whatever. That's how it should feel. You will want to keep that covered with the Band-Aid for only for 24 hours, and then you can take it off. Gently wash the area with antibacterial soap, and and that's really it. And so I said, okay. And so she proceeded. As she was proceeding, I was feeling it. I didn't say anything like right away, but when she went in to like go in further, and I felt even more pain, I went ahead and told her that, okay, I'm feeling that. And she's like, well, we can't have that. She's like, we don't want you feeling it. So she told the nurse to inject me some more. She injected me some more. And she was like, how about now? Are you feeling that now? And I told her no. And she's like, okay, that's what we want. We don't want you to be able, we don't want you to feel that. And so, anyway, she went ahead and did the procedure. Again, to me, it felt like it really took less than under the 10-minute mark. Before you know it, she was like, I'm done. And I said, you're done? She was like, I'm done. And so, she put the Band-Aid on it. She repeated herself by saying to keep it covered for 24 hours. After the 24 hours, you can take it off. Gently wash it with antibacterial soap. And that's really it. And just make sure you put the Neosporin or Vaseline on that area. And I just told her, okay. I thought for sure they was gonna, provide me a like a aftercare paperwork, because I guess I'm used to that, or maybe I should use the word spoiled to having that. So, but they didn't. They just was just with word of mouth. I didn't even get a paper that's with instructions. I know, like I guess I'm used to that, because any other type of procedure I always had paperwork. So that way, just in case I will forget, because sometimes I like to make sure that I didn't. I don't like to just rely on my auditorial, what's the word? Auditorial, memory here. Okay. I actually like to, be able to see it visually as well, because I think I am a more visual person regardless anyway. And so I'm always comfortable, when doctors give me, instructions on how I need to treat, whatever it is that I went and got, done or got seen for or whatever. So, I'm just comfortable with that happening like that. So anyway, they didn't do that. So, I was a little, not gonna lie, I was a little disappointed with that, that happening like that. But I kept trying to. I mean, it was simple. I mean, they didn't give me like a long list of things anyway. So, I mean, it was pretty simple on the instructions. I mean, the instructions was just to put Vaseline or Neosporin, gently wash the area. So those were the instructions. So I guess it wasn't nothing too complicated that I could not remember. It's just the fact that I wish that they would had, I don't know, did that. So anyway, moving past that, when I did get that same day that when I got home, um, obviously the numbing medicine was wearing off because I started being in pain as soon as I actually entered into my house. I started feeling pain in that area that the biopsy was done at. And so I went ahead and took a Tylenol. And after I took the Tylenol, to be honest, I felt like the Tylenol helped a little, but not enough. I mean, I was had a lot of discomfort in that area. Just moving that area was very difficult. Even holding things was super difficult. And I'm gonna be honest with you, like even like right now, it is still hard for me to hold things sometimes. My recovery is a lot better compared to what I was experiencing earlier this week, because Tuesday I had to run going to urgent care because of the fact that my arm was feeling numb, my hand was feeling numb, but that wasn't the only reason. I was in a lot of pain. Um, and I could tell that area was inflamed, and it definitely looked infected. So the urgent care person, or the I say urgent care person, the urgent care doctor, she was really nice. She said that what she can do is prescribe me some oil antibiotics for me to take. Specific, because she said that that's not normal. She was like, you shouldn't be in this much pain. She told me the area looks fine to her though, but she said that what's concerning to her is that I'm saying I'm in a lot of pain, and so she said I shouldn't be in pain. So she said that I could have an infection. She said she don't see that. I mean, it doesn't look like, she said when she's looking at it, it doesn't look like I have an infection to her, but she said by me just being in a lot of pain, I mean, obviously maybe I am trying to develop an infection. So she said she's going to prescribe me some antibiotics, which she did. I've been taking it. And also shout out to my sister, because my sister also that same day had bought some Neosportin, but the Neosportin she purchased was called Lactone, so it numbs the area. So with my sister doing that and the doctor prescribing me some antibiotics, both those things was very helpful, because I started receiving results the next following day. My arm was feeling totally better. I mean, I want to say, well, when I say totally better, keep in mind, I'm basically compared to all, because I was like suffering, like pain wise. Like my pain was at 9 and 10. So from the 9 and 10, by the next following day, I was really probably at a 4, maybe a 3. So that's why I said that's why I used the words that I used about how I was feeling totally better, because compared to feeling at 9 and 10, and now feeling my pain level is at a 3 or maybe at a 4, that's a huge significant difference. So I was fine with that. And so yeah, so today is Friday, and my arm is still improving, and I'm still taking my antibiotics like I'm supposed to. The wound itself is starting to look better. Is definitely going to be a scar there, and she even told me this too, that I'm going to definitely have a scar there. But at least they did a biopsy, and the biopsy was benign. So she called me, well, not the doctor, but the nurse called me on Monday, this Monday actually, and let me know my results. And my results was when they let me know that what I had was a dermatofibroma, which is a skin growth, and it was benign. And so there's nothing else I really need to do. They told me there was no I didn't have to come back to them, because everything was benign, and I'm good to go. And so I just told them okay. I just told the nurse okay, and I said thank you. And that was that. I mean, I had the biopsy done, and now I'm just trying to recover from it, which they told me it will take 14 days to have a full recovery, as far as not feeling any type of discomfort. And of course, my skin, the healing process of it will probably take 14 days total. So as long as I do what I'm supposed to do on my end, which is, apply the Neosporin, apply the Vaseline, I should be good to go. All right. So what I want to do is kind of like also give y'all a little bit of a background knowledge, a little bit more knowledge about dermatofibroma, because if you're like me, I honestly never knew anything about it. I had no idea it even existed. I mean, I've heard of skin cancer, so don't get me wrong. I've heard of people having skin cancer, but to be honest, I never knew what that looked like or how that looked like. And as far as people having like cysts on their skin, I've heard of that too. But again, those were things that I honestly didn't know, like how I didn't know how that looked like or how that, how that's supposed to look like. I never knew, and I never I never knew anyone personally that was dealing with that. So at the end of the day, I'm just really just trying to bring awareness about dermatofibroma, just because I think it's important. Just because, like I said, I was like, honestly, when I very first developed it on my lower left arm, that's where it very first started at, and then eventually I started noticing it going to, like, I'm starting to have it other parts of my body. And so like I said, it just starts out looking like a simple insect bite. I'm just going to go ahead and kind of give you a little bit more knowledge about it. So a dermatofibroma is a common benign fibrosis nodule, usually found on the skin of the lower legs, upper arms, or upper back. But I honestly want to say that it can probably be anywhere else on your body, also. So just keep that in mind. These nodules are common in adults, but are rare in children. They can be pink, gray, red, or brown in color and may change color over the years. They are firm and often feel like a stone under the skin. When pinched from the sides, the top of the growth may dimple inward. Right? Dermatofibroma. Okay, let me re-say that. Dermatofibrosis or dermatofibromas are usually painless, but some people experience tenderness or itching. Most often, a single nodule develops, but some people can develop many dermatofibromas. They rarely grow larger than a half an inch in diameter. The cause of dermatofibromas is unknown. Now, I kind of want to like stop right there off of what I just read to you guys, because in my case, I didn't experience any itching at all. Like, that area on my left lower arm never itched it whatsoever. But what I did dealt with was pain. And I know that I read about it, says usually it's painless. But in my case, it was painful. All right. And I had 6 total on my body. Now I'm down to 5. And the ones that were painful, I had 3 total that was painful. Now it's down to 2 that's painful. So the one on my left lower arm was the painful one of all, but I also have one on my right upper arm, and it's painful also. It's tender to touch and it's painful. The one on my back is also painful, but the 3 that's on my left leg is not painful at all. To touch it, a little tender, but it's not painful. And so those 3 on my legs is not painful, not really at all. But the ones that is painful is the one on my upper arm, on my upper right arm, and the one that's on my back now. Okay, and so I'm dealing with 2 now that's painful, and when I say painful, like, my pain is at an 8 with that, about 7 and 8. My back and my upper right arm. But she didn't want to address it. My dermatologist, the one that I just saw, she said she didn't want to address it. I'm not gonna lie, I was a little upset about that and concerned why she didn't want to. But after experiencing the healing process with the biopsy with my left arm here, I think now I'm totally glad she did felt that way, because I didn't think I was going to be in that amount of pain. I mean, keep in mind, my dermatologist made it seem like everything was, it's not painful at all. That it's just like getting a simple scratch, and that's it. That's exactly what she told me. And so I didn't really expect to be in pain, but yeah, it's painful. After getting a biopsy, it's definitely painful. I almost thought they should have had put stitches in my arm, because how it looked it, and even my family was also saying the same thing that we're looking at it. They're like, that almost looked like you did needed stitches. Oh, just about. But obviously I am healing just fine now. I am anyway. I'm healing just fine. Obviously I didn't need no stitches. It's just that I think I was dealing with, or about to experience or deal with, some type of infection that now I think I'm out of the woods with that now, especially with taking the antibiotics and putting antibacterial, putting the ointment cream, which is the Neosporin, and that's like antibiotics. So yeah, so I'm definitely starting to see a difference, like I said. But I just wanted to let you know that they can be painful. I guess it just depends with that. All right. And so the cause of it, they said it is unknown. They don't really have a clear reasons as to why people get it. All right. So there is no clear reason why some people develop dermatofibroma. They occur when skin cells called fibroblasts overgrow, forming a bump. But the reason why this occurs are not entirely clear. One theory is that a dermatofibroma is a reactive growth. This means it occurs as a response to something, which could be a mild skin trauma, like an insect bite or a cut. And mind you, keep in mind what I had previously said to you guys. I said that it started out looking like a bump on my left lower arm. And I'm gonna be honest with you guys. Even on my left leg, I was having when I noticed it, it was also looking like a bump, like on my lower left leg. When I very first saw it, it looked like I've been bitten again, like an insect bite. So that's how it looked. And so, after doing more research about dermatofibroma, doing this research, so I can bring awareness, I'm learning how it does start off looking like insect bite. So now it makes sense as to what I've been saying to the doctors all along, because I've been telling the doctors, hey, it started out looking like a bump, it really did, like an insect bite. And it clearly states, when you do your research about it, it clearly states that it does, it starts off with an insect bite or a cut, like it's some type of trauma obviously happens, would cause it to occur. And basically they classified it as like a reactive growth, basically. So women are more likely than men to develop them. I don't know why, but that's what they're saying. They're saying more women are the ones that's basically coming forward and saying that they have this on their skin. So people with a weakened immune system, such as those with other illnesses like lupus, may be more likely to develop this growth. That's what I also, when I was doing my research, that's also what I saw. They mentioned about lupus. They also mentioned some other things. But honestly, I mean, they also said that it's just really uncertain as to why you get them. Like, it's really, it's like not clear as to why, but they also said it could be because of an insect bite, and maybe, that area just, I don't know. I really don't have any answers as to why. And obviously my primary care doctor didn't either, because she was like, she was being honest with me. She was like, I do not know what that is. She's like, I can't even tell you what that is, but it is concerning, and I definitely want to refer you to a dermatologist. So she did her job, and I'm grateful for that. Like I said, I don't know. So I do have pictures of how the bump looked like before I had the biopsy removed, or before I had the biopsy done. I'm sorry, my wording is horrible. Okay, so I have a before picture before the biopsy was done on that arm, and honestly, the picture that I have is a picture that I literally had sent to my sister because my sister wanted to see how the bump looked like. Because when I told my sister about it, she was like, "Can you send me a picture so I can see how that bump looked like?" So I took pictures for my sister, all right, and I didn't even think that I was going to come forward with awareness or bring awareness about this, because I didn't really think this was something that, obviously, I didn't know. I didn't know what it was, so I didn't know if there was something to be concerned about. You know what I mean? And I am grateful and blessed that it is just benign. But keep in mind, when the nurse told me, yeah, this is a skin growth, it was definitely a skin tumor. That's alarming to me a little bit. You know, I mean, I'm blessed and grateful that it's benign, but it makes me want to bring awareness to everyone else, because if it could be other people out there that's exactly like me, that's exactly like me, like, have this on their arm or their or whatever parts of their body, and don't have no idea what it is or anything like that. But it's always best, like, if you see something on your body and you really unclear as to what it is, especially you wasn't born with it, then you definitely need to go to your primary care doctor, or if you have like a dermatologist, then you need to go ahead and reach out to your dermatologist. That's super duper important. All right. So I do have before and after pictures. And so what I was about to say is that I'm going to place those pictures on my Kiki's Talk Facebook page. So if you're not following me over there, or if you're not following me over there, you definitely want to follow me over there at Kiki's Talk Facebook page. I'm also going to put this on my website. And I do have a website. I'm going to place it on my website as well. All right. And so it's easier for you to just go over to Facebook if you have a Facebook, and just search Kiki's Talk, KEKE apostrophe S Talk, TALK. All right, go over there. Please hit the like button, and you can look at the pictures over there. Also, on my website, you'll be able to get to my website from going to my Facebook page. It's just easier for me to say it like that. All right, but I do want you to go check out my website, because I'm going to place those pictures on my website as well. All right, and I have did some remodeling. All right, I also did some remodeling or updating on my logo too. So I've been doing the thing. Right, and so I've been wanting to do my episodes for such a long time now, and I don't know. At the end of the day, I think it's just excuses, really, what it comes down to. All right. But I'm not trying to make excuses, but obviously, I've been saying I'm going to get on, and I haven't got on at all. I even have my babies, my kids, they're like, "Mama, when are you going to do your podcast? You haven't done your podcast in a while." And I'm like, I know. But yeah, so they're going to be proud that that I did my episode. They're at school right now, but they'll be proud. All right, so what's the next steps to take after having after you know that you have dermatofibroma? If you detect a new bump on your skin that does not go away, it is always important to have it checked out by a doctor to make sure it's not a skin cancer. A doctor can confirm the diagnosis by using a special magnifying glass called a dermoscope. They may also take a tiny tissue sample called a biopsy, just like what I had did, to examine under a microscope. Once it's diagnosed, you can discuss your treatment options with your doctor. You can leave it alone or get it removed. So in my case, it was removed on that arm, but all the others that I do have, and they look exactly like how my arm looked, she's not going to mess with it. And like I said, at first I was a little disappointed about that, but now after I see that the biopsy, after the recovery of the healing process of the biopsy, it's not easy peasy as she worded as. So now I'm just content and happy that, you know, that she felt that way. All right. So yeah, so I'm good. But if you do have it, y'all, the important thing that you need to realize is that once you do get dermatofibroma on your skin, or whatever part on your skin, or whatever part on your body, basically, just know that it's there for life. Once it develops and once it's there for life. It's nothing you can do about it unless you do go to a dermatologist and have it removed. It's pretty much there for life. And not only that, but also, if it do get removed, then be prepared to know that you're going to have a scar there for life. So either way, it's something that's going to remain there for life. It's kind of disappointing in a way, but it is what it is. And it's just something that I have to face. I have to face that I have a scar on my lower left arm for life, and it's nothing I can do about it. But the most important part is that it's nothing to worry about. You know, it is a benign skin growth. It's a benign tumor, basically, but it's nothing to worry about. All right, so that's all I want to talk about as far as the dermatofibroma. I hope everything that I discussed, you found it valuable. But my whole purpose of talking about this is just really to bring awareness. I mean, that's it at the end of the day. I just want to bring more awareness about this because, like I said, more and more people is probably dealing with this and have no idea what they're dealing with. They have no idea what they're dealing with. Just like me. I had no idea until I went to the doctor, and that is just my recommendation for everyone. Like if you have any type of bump or whatever on your skin, then and you don't know what it is, and it's bothering you, or even if it's not bothering you, just the fact that it's there and you have no idea what it is, don't be afraid to go to a medical certified doctor to find out. All right, don't be afraid to do that. Definitely do that. All right. That is really my advice right there. Okay. Let me see here. I was going to proceed with something else, but I think I'm just going to end it on this note. All right. Thank you guys so much. It feels so good doing my podcast episode. It's been a while, but I feel like, even though it's been a while, I feel like it hasn't at the same time, if you know what I mean. All right, so I'm ending it on this note. Have a beautiful, blessed day, and you will hear from me soon, I promise. Bye.